Good evening, and thank you for attending our Chippewa Valley Schools Community Health Forum. Our community will have the opportunity to ask questions via a chat question and answer. That option will open as we progress through the presentation. Right now, we'd like to start with introductions and welcome from our superintendent, Mr. Ron Roberts.
Hello, everyone, and welcome to our Community Mental Health Forum. I think this evening we've put together a really good program here for you, and we have some very knowledgeable people that will be presenting some information that I think will be of value to you. I think we find ourselves here today, really a lot of this comes from the pandemic, although having good mental health certainly didn't come to the forefront, or at least didn't originate with the pandemic. We've always considered this an important topic in Chippewa Valley schools. I just think it's as you know, and we'll present some data that kind of supports this, that mental health has become more of a topic in the last few years. And that's the purpose of this, because we're here to support our students, and we're here to help our parents support our students. So I'm going to start with some introductions with the people that are here. So we have Dr. Charlene McGunn, who is the Executive Director of the Chippewa Valley Coalition for Youth and Families. And I think many of you know Charlene just from the work she's done over a number of years in our school district, very knowledgeable. Dr. Donald Broski, our Assistant Superintendent of Educational Services. And then we also have Marina Licari, our Executive Director of Elementary Education, Paul Sibley, Executive Director of Secondary Education. And then we have, from our new partnership with Uliance, we have Kent Sharkey, who is the President, CEO, and founder of Uliance. And then also from Uliance, the Vice President, Darren Miller. So it's a wonderful panel, and these people will be presenting some valuable information. So this is what we want to cover today in this program this evening. We're going to talk a little bit about the mental health survey results, the survey that we conducted with parents back in the autumn. And then we're going to learn about perspectives on youth mental health, and that will be Dr. McGunn. And that's really some very interesting information that you'll want to see and hear about. And then also the district resources that we have that are available to our students right now. And then we're going to end with the partnership we have with Uliance, and that's something new with our school district, and so we want to make as many people aware of that as possible, in case you as families find that to be a valuable resource. And they're going to talk about their Student Life Advisor program, and that's for all of our students K-12. So I think what we're going to do right now is start with some survey results. Last fall, we did a survey asking our parents to respond to some questions about their perspectives on mental health. And we were very happy to have 1,385 respondents in that survey. And you can see here with some of the data presented here, just in relation to COVID and how our students are handling going through COVID and their state of their mental health. You can see that 71% of our elementary parents and 81% of our secondary parents thought that kids struggled more today emotionally than they did pre-COVID. And those, to me, are very significant numbers. Those are very high. And so that's what brings us here today. So some of the other survey results, you can see here that a significant percentage of parents thought that counseling services were insufficient. And I think our community mental health, and as we know, what's happened to community health over the years in our state, and the just decline in services available to people. So people recognize that. And then also, we wanted to know that if services were available to our families, if you as parents would take advantage of that, if the need were there. And you can see here, 40% of our elementary parents and 58% of our middle and high school families said they would take advantage of it. So those are really very strong numbers and show a need from our families for support in this area. So that's what we're trying to do. And so here, these are some things that we've done this year in order to address some of the needs as we see them, and based on your response and our feedback from students, we will be adding a counselor to both of our high schools. And we think that's very important because counselors can sometimes get bogged down in just the day-to-day things they need to do in counseling and some of what we might call more busy work. And we need them to be available to see students. So we've hired, we'll be placing a counselor at each of our high schools. We've also put in an additional school social worker at the secondary level. And that's been something that's been requested that we thought was important that we do. And then we've put in place a intervention specialist at each of our 4 middle schools, and we'll hear a little bit more about what that means. But we saw that as a need. And then we also, and the last thing you'll hear about is our partnership with U-Alliance and our Student Life Advisor Program. So those are some things we've done, and you know what we want to try to cover this evening. So we'll move forward here and let you hear from the experts. So there we go. And this is Dr. Charlene McGunn, and she's going to tell us a little bit about some of the data. So Charlene.
Thank you, Mr. Roberts. As was mentioned, I'm associated with the Chippewa Valley Coalition for Youth and Families. This is a long-standing partnership of Chippewa Valley schools, our families, and a broad range of community. And our efforts are the promotion of healthy, resilient, drug-free youth, and our efforts are to prevent youth suicide. I'm going to provide a bit of information that gives a snapshot of the national level, and then we'll talk about what our Chippewa Valley schools students tell us about the status of their mental health. Moving on, I'm going to give you a little bit of information from the Youth Risk Behavior Survey, YRBS. This is from 2021. It's the most recent information, and this comes from the CDC. This is the largest national survey. It's sponsored again by federal government, and the effort is to identify a broad range of health factors that affect youth. Over 17,000 high school age youth participated in this survey. So I'm going to give you just a few brief points. What this survey really indicated, and you may have heard it on the news in the last couple of weeks because it's been broadly publicized, because what was the survey really indicates is the worsening of youth mental health in the U.S. It also indicates that this trend began prior to the pandemic, that while the pandemic may have accelerated some issues for youth, youth mental health had begun a decline prior to the pandemic. And just to give you just a few points in this survey, which takes in middle and high school students, but 40% of the boys and girls that filled out this survey nationally reported feeling so sad and hopeless for 2 weeks that they weren't able to engage in usual activities. So that's a heightened suggestion of really a deepening of mental health issues. What's also concerning is what the information provided about teenage girls, and that is of the girls that completed the YRBS, 3 in 5 reported consistent feelings of sadness. This is an even higher number for our LGBTQ youth, where 70% reported sadness and hopelessness, and more than 50% reported poor mental health over the previous days. I'm going to show you just a little bit more information as we sort of pull this apart. And this is going to show you the difference of male and females adolescents. This is the national high school data. And girls tend to always report higher levels of depression than male students. One of the reasons for this, there's many things that are speculated. We don't know why for sure, but part of it really can be the dependency of teenage girls on the social context. So they're very sensitive to what goes on socially. And what we can see here is that 57% of the high school girls that filled the survey out reported sadness and hopelessness versus 29% of the boys. The next slide addresses those students that seriously considered suicide. And here we see a difference also between males and females, with 30% of the girls that completed the YRBS reporting seriously considering suicide versus 14% of the boys. And of course, 14% of adolescent boys reporting suicide, a suicidal thought is very concerning as well. The next slide talks about suicide attempts. And here we see 13% of national teens that completed the survey reporting that they had attempted suicide within the past year. That's versus 7% of the males. So what we are seeing is a trend that's, depression is trending up. But again, this trend began around 2017. So it began pre-pandemic and it's continued to this point. If we look at sexual violence among high school students, here we see an increase over the last several years in female students who report sexual violence. 18% nationally reported experiencing sexual violence at some point in their life. And 5% of male students reported having experienced sexual violence. So we're seeing concerning trends on the national level. Let's take a look at our local information. The Michigan Profile for Healthy Youth is a survey that's done every 2 years in school districts across the state. And it is an anonymous survey. It is done with parental permission. Our survey results are very similar to those of school districts across the state. And MyFi, unlike the survey I mentioned previously, selects 7th, 9th, and 11th grade versus all grade levels that are included in the national survey. Let's take a look at what we learned about the mental health issues of our students. These are the 9th and 11th grade results. We don't do this survey at middle school, this element of the survey. And as you can see, from 2016 to 22, there is an increase in reported depression for 9th graders as well as for 11th graders. And again, this follows a national trend. We can't actually compare our information with the Youth Risk Behavior Survey, the national survey, because that takes in more grade levels. Our students also reported, if we can go back to the other slide just for a moment, our students also reported an increase in serious thoughts of suicide, both at the 9th and the 11th grade level, with 21% of our 9th graders and 20% of our 11th graders reporting having suicidal thought. We can go to the next slide. Here we have the percentage of students who attempted suicide 1 or more times during the past 12 months. And we have 11% of our 9th graders reporting having attempted suicide and 6% of our 11th graders. So reasons to be concerned, and we look at this data, by the way, to plan our programs, both on the district level in collaboration with the coalition. Next slide, please. If we look at some good news that's emerged over time, it is a decline in youth use of alcohol, marijuana, vaping, and other drug use. And there is an association, a real connection between youth mental health and youth substance use. Youth that use alcohol, marijuana, that vape nicotine, use other drugs are much more likely to experience mental health issues. So let's take a look at, very quickly, a bit more of the data. This is past 30-day alcohol use reported by our 11th, 9th, and 7th graders over time. You can see a general trend of decline. We're still concerned about the levels of use, but there is a marked decrease in 2022 compared to that reported in 2020. This is probably pandemic effects, and we're going to be looking at this over time to see if this is a sustained trend. So we're happy about declined alcohol use. If we look at marijuana use, past 30-day use, reported by our 7th, 9th, and 11th graders, again, we see a marked decline. For example, at the 11th grade in 2020, 25%, literally 1/4 of our 11th graders reported past 30-day marijuana use. And in comparison to 2020, which was 17%, that's statistically significant. And then if we look at vaping, and this is vaping nicotine, again, we show marked declines. So this is the good news, and we're going to keep an eye on this trend as well as the mental health trends. I'd like to share a resource, and that is our website. It has a great deal of information for parents, students, and community members, and a variety of resources. And now I'd like to turn the program over to Dr. Don Brodsky, Assistant Superintendent for Educational Services. And Dr. Brodsky is going to present some of the information on district resources.
Thank you, Dr. McGunn. There are resources available for students and families at the district, elementary, and secondary levels. New to the district this year is the Outreach and At-Risk Specialist. And that person has been instrumental in the development of consistent practices and procedures that support social emotional learning and student well-being through work with district steering committees and building teams throughout the district. This includes social emotional learning and student wellness with a focus on character, awareness, relationships, engagement, and students' sense of belonging in the school. The district crisis coordinating team, comprised of district social workers, counselors, and school psychologists, assists our school crisis teams in supporting students, parents, and staff when a serious circumstance, such as the death of a student, parent, or staff member occurs. The DCCT also provides information related to crisis response, grief and loss, and community resources. Our Parent Education Network works with student assistance specialists during district-wide events for students and families. And the Chippewa Valley Coalition of Youth and Families brings together Chippewa Valley students, parents, and community in a partnership to support district students and families. More information can be found on the district website. There are partnerships with community agencies and the coalition that provide individual, group, and instructional services pertaining to mental health and drug prevention for students and families. For instance, Sandcastles provides support group, grief and loss programs for children in preschool through high school and their parents at no charge. CARE of Southeastern Michigan delivers elementary drug prevention programs, supports health fairs at the high schools and coalition events, and provides parenting education. Macomb Family Services runs student support groups at Chippewa Valley, Dakota, and Mohegan High Schools. We also have connections with the MSU Medical School, U of D Mercy, multiple Macomb County agencies, Turning Point, and law enforcement in Clinton Township and in Macomb. Now I'll turn it over to Ms. Marina Licari for information on resources at the elementary level.
Thank you, Dr. Borowski. As mentioned, obviously in the district, we have many resources that are available. I'd like to just take an opportunity to kind of pinpoint some of those resources that are specific to elementary. In each of our elementary schools, we are very fortunate to have a dedicated social worker, and that social worker is able to not only work with students and staff, but to also provide supports to families while working with students in the building on a daily basis. Additionally, we do have school psychologists that are assigned to each of our elementary buildings that also offer supports to our students, our staff, and our parents. And in conjunction with the school staff, our schools each have a positive behavior intervention and support system, or as we often refer to it, a PBIS system. And that system really is an opportunity for schools to work with their students to identify, teach, and model desired behaviors by encouraging students when they demonstrate positive behaviors in school. Additionally, we have dedicated a crisis team in each of our buildings so that in the event that something does occur, we do have staff that is ready to support, whether that be students in the building, students that may not be attending for other reasons, or even family members that need that additional support, as well as our staff members. And then finally, at the elementary level, as was previously mentioned across the district, we do have an opportunity to provide parents, often in the comfort of their own home, webinars and programs that are informational and can help them to support their children in conjunction with our schools. I'll turn it over now to Paul Sibley, who can speak specifically about some secondary resources.
Thank you, Marina. I just want to say good evening, everyone. I'd like to just start by saying that we want to continue to share with you our continuous efforts to always improve what we're doing for our students. It's something we take very seriously. The data from Dr. McGunn that was presented earlier, as well as the feedback we get from students and parents, help us really shape what we try to offer through our community. We know that mental health support begins with relationships and connectedness with all adults and students in our buildings, but as Marina mentioned, it's also important to point out the specific positions and programs that we offer in our buildings, specifically here at the secondary level, within our middle schools and our high schools. So each of our buildings at the secondary level have multiple counselors. We have 11 counselors currently serving our 4 middle schools, and we have 15, soon to be 17 counselors serving our high schools, including 1 additional counselor that we'll be adding at each high school, which Mr. Roberts mentioned earlier. We have counselors that are committed to serving their students any way they can, but they're really specifically skilled in identifying resources for students and families while guiding them through their academic careers. They often have a strong relationship with students, many of whom may need somebody just to run some ideas by or ask questions about their future. We're extremely fortunate to have the counselors that we do in Chippewa Valley and their commitment to our students. As Mr. Roberts mentioned, we've added intervention specialists at all of our middle schools. So we now have intervention specialists at each of the secondary buildings who work with a specific group of students on their decision-making, daily approach to their daily relationships and education. They also do a lot of work with restorative practices if there's conflict between students and bringing them together so that we have resolution when they come to school together. We also have student assistance specialists at each of our 9th grade centers and our 10-12 buildings who provide a range of prevention and intervention services related to student substance use and associated issues, as well as referral services to our parents. We have social workers and school psychologists who serve each of our secondary buildings, and sometimes multiple in a building depending on the size of the building. As Marina mentioned at the elementary level, each of our secondary buildings also has a positive behavior interventions and support program. PBIS program is what it's known as. Each building has a crisis team which can work independently or collaboratively with the district crisis team that was mentioned earlier. And at the secondary, we still offer webinars and programs for parents, often called dialogue nights, parent night out, which incorporate parent education and often our own students who talk about their experiences in our schools. Our Coalition Teen Council, which is mentioned at the bottom there, those are programs at each high school that are involved in a variety of school and community events to bring awareness to social issues facing our youths in today's society. Those programs have really expanded, and they're just a marvelous group of kids who work directly with our intervention specialists. So all that being said, I will bring it back to Dr. Broski, who will talk about one additional resource that Chippewa Valley has invested in to be available to our students.
Thanks, Mr. Sibley. In January, the district made available a program that provides counseling, crisis intervention, and resources for our students called the Student Life Advisor Program. Here this evening to provide an overview of the program, Mr. Kent Sharkey, CEO and founder, Mr. Darren Miller, Vice President of Uliance, a provider that specializes in services to help keep students emotionally and physically fit while supporting parents along the way. Gentlemen.
Thank you for the introduction. It's been a wild ride the last 3 years, and we've seen, as evidenced by the survey results, and more importantly, our own experience with our friends, relatives, and our children. As a parent myself, I've seen my own children go through challenges and struggles. So the district pursued as much support as they already offer. They believed there's more to be done. And so they implemented the Student Life Advisor Wellbeing Program in January. And I'm going to give you a brief overview of what those services are. Next slide. So we provide counseling. We have all licensed master's or doctorate level counselors that work with different age groups of children, parents, families. It's short-term counseling in nature. We also provide crisis intervention 24 hours a day, 7 days a week. So even when school is not in session, there's still support for parents and their families as it relates to their student. As you've seen and heard, there's a tremendous amount of resources available for students, but as a parent, we don't really think about those until we need it. And what's occurred over the last 3 years during the pandemic is many of these statistics we've heard before, but now more importantly than ever, we've experienced it again amongst our own families. And when we experience those types of challenges, it becomes more real to us. And so we really don't know where those resources are. The Student Life Advisor Program can help with that. And then we have a tremendous portal. So we're high touch as well as high tech. And if you know your students, they carry their computer with them called a smartphone 24 hours a day, and in some cases actually sleep with it. So we have a tremendous amount of resources and information available. So why call as a parent? So it may be that you notice your child is becoming withdrawn, maybe more defiant, struggling in some way, just seemingly out of sorts. And there's a pattern that begins to develop. And us parents have kind of a spidey sense, right? We know, even though things aren't maybe being said, and maybe our teenagers or our middle schoolers, or even our elementary students really don't share their feelings and what's going on. You hear common things like, how was your day today? And you'll hear fine, good, or sometimes just a groan. And so those are age appropriate responses, but as a parent, you begin to notice that things have changed a little. Your student is impacted. Perhaps there's something going on in the family. Maybe there's a divorce that is going on, or there's conflict in the family some way. Maybe a parent has an issue at work or what have you, and there's additional strain and tension within the family. Maybe it's a grandparent who's come down sick or ill, and it's again added additional stress. Certainly what we've seen during the pandemic is there's been more deaths than any time in the normal period of our lives. And although that's lessening, you know, we're still not out of the woods yet, so to speak. Slide. So what can you do? You can call a student life advisor consultant. These are degreed behavioral health specialists, and they can support you. They can provide information about what the program is consists of. It's confidential. That's protected by state and federal laws. So the privacy of your family is the utmost importance to us, and we take that very seriously. And we're available 24 hours a day. And there's an easy 1-800 number, toll free, and you can reach a counselor who can talk to you about your particular situation, or your child can reach out as well. Children that are 14 years or older are able to contact us directly and receive support. Under 14, they are required parental permission, and so we would seek that out. Next slide. So what type of counseling do we do? It's short-term, it's solution-focused, and what I mean by solution-focused is many counseling models stem back into somebody's very early childhood, things of that nature. We look at an issue in a very cognitive way and say, okay, what is occurring now? What is the root cause? What has been helpful? What hasn't been helpful? If you woke up in 6 months from now and your life was different, what would that look like? So solution focused, we don't dwell so much on the problem, but more in terms of where you want to see things evolve to and develop. There's 1 to 5 sessions, and that's per issue. So a student could have more than one issue throughout the year. Maybe they've gone through a bad breakup. Maybe they're a junior and they have the stress of perhaps college and maintaining their grades, and perhaps extracurricular activities such as sporting events, things of that nature. It seems for some reason the 11th grade year is particularly challenging. We provide in-person, telephonic, or video-based counseling and support, and licensed counselors are who conduct that support. So let's talk a little bit about the crisis intervention. This is really for emotional crisis. So the Student Life Advisor program, we're focused on the emotional well-being of your student, your child, and how to help them to cope and deal with things that maybe they're very green and they have no experience. Certainly they come to us as parents on many occasions, and hopefully we've developed that type of rapport and relationship with our child. But it still feels sometimes a little risky to do that. Maybe they don't want to disappoint a parent. So they can reach out to us and speak to a counselor immediately if there's a crisis, and simply by calling an 800 number. So let's talk a little bit about our Student Life Advisor Wellbeing Portal. You can see the URL, the website address listed here, and it's on many different promotional things that we do throughout the school year to make students and their parents aware of the services. They simply log in with their school name and the city of which their school is in, and they have access to just a ton of well-being information. Sometimes it's about healthy relationships. Sometimes it's dealing with school stress or test anxiety, things of those nature. And sometimes it's about physical well-being. Perhaps somebody wants to improve their time in their cross-country events, and they want to track their speed and accuracy, things of that nature. They can do that through a Life Advisor well-being tracker. So creating success support outside the classroom. So some of the issues that we deal with, certainly not limited to this list, but we've seen a tremendous amount of anxiety. So the statistics that were shared with us earlier are of no surprise to any of us. It's really validating for what we already suspected. Anxiety has been a huge issue, particularly before the pandemic, but certainly increased during the pandemic. We have children today that are going to be dealing with those issues in the future. Hopefully we can get back to more stable footing and it will become, a memory in the past. But emotional issues, depression, we heard a little bit about that this evening. So we are all human and we feel different levels of anxiety, depression, stress, but we're really talking about things that are progressive and tend to get worse without intervention. School-related stress, finals certainly that I think just passed for the semester not too long ago, a tremendous amount of pressure that our students feel. It's a very competitive world out there. And my students are now graduated from college, but I can very clearly relate to when they were in high school and the pressure to achieve and the social requirements that they felt. And it was really a different time than when I grew up and went to school. And then, of course, loss or change. Even a positive thing has change and therefore stress associated. So we're there to support. So a summary of benefits, it's confidential, 24-hour access. You can call and talk to a Life Advisor consultant. You can call at this very moment or anytime during a holiday. We're always available for you to support. And then certainly our 800 number and our website for easy access, either through an app or a web portal.
Thank you very much, Kent, and the rest of our presenters. We have some great resources available for students. And right now, our question and answer is open for any audience members. If you'd like to submit a question, there's a chat option to the right side of your screen. You can send us questions. And I'm going to ask Darren Miller from Alliance to address our first question. And Darren, if you don't mind, the question we're posed is, are we required to notify a parent if a 14-year-old student is seeking help through Alliance?
Sure. Great question. Thanks for letting us come and be here with you tonight to address the parents and some of these concerns. In the state of Michigan, a 14-year-old is able to seek out help for mental health counseling without parental permission. One of the things that we at Alliance do is we encourage, because we know how important family support is in every situation, especially when it comes to your child's mental health. And so we would encourage your 14-year-old or older student that may call us to involve the parents. However, HIPAA does allow for that student in the state law in Michigan. It does vary in other states, but in the state of Michigan, it's 14 years and older that can seek out help to talk to somebody without parental permission. Again, we would always encourage your student to involve the parent because we think that's very important for their overall well-being. but that is the law in the state of Michigan, is that they can't access services at the age of 14.
Thank you so much for that. Our attendees, that Q&A is open. I'm not seeing any new questions yet, but we can wait here for a minute, give you a minute to type. If you have questions about support offered in our buildings, resources available to students, or how Alliance works to support our students, please feel free to jump in that chat.
I would like to just comment that parents are able to reach out to us as well with concerns that they might have regarding their student, or just to check in and say, you know, I don't know if this is a big deal, but let me run something by you. And I think that's helpful. The service is, you know, not for the parent per se if they're experiencing an emotional challenge or relationship issue themselves, but if the issue is related to their student, very much encourage you to give us a call and have a discussion about how we can support. We can be objective because we're not involved in the situation. We can be a good sounding board. And sometimes just some other ideas to consider about maybe reaching a child who's become more isolated and distant. Because as a parent, we are always concerned about our children, even at times when there may not be anything to be concerned about. So that's just the nature of being a parent, and we understand that.
Absolutely. Thank you. We do have another question in the chat. I'm going to ask Ms. Lakari to address this. Ms. Lakari, the question is, are the psychologists that we have at the elementary available daily?
It would depend on the school, but our psychologists are assigned to an elementary building. Oftentimes they're assigned to 2 buildings, so they may split their day. It just depends on the combination of their schedule. Some of our psychologists have a split day where they will be at one school and then the other half of the day they'll be at a different school, or they may have a schedule where every other day they alternate between the schools. But we do have psychologists that are assigned to and in our buildings on a daily basis. It just depends on the combination and their schedule.
Thank you so much for that information. And right now, that's all the questions in our chat. We can maybe wait for another minute, make sure all of our audience have had the opportunity to send in any questions they might have. And if you have questions about the services offered during the school day, how we support students in our schools in their mental health, questions for Dr. McGunn about data and mental health and drug use, or questions about the Alliance system, we are open to take any of those questions. I am not seeing any more questions in the chat. Please know if a question comes to your mind later, feel free to reach out to any of the Chippewa Valley staff on the call or to Alliance with the information provided tonight, and we would be happy to answer your questions. And I would like to turn it back over to Mr. Roberts.
Okay, thank you, Sarah. First, I just want to thank our panelists that were here tonight. I work with many of these people and they're very impressive, and I know that they're here to help as a resource for all of our community. And thus far, our work with Alliance, I think we're off to a wonderful start, and from everything that I can ascertain and through conversations and meetings with them, they really care about students and want to serve our community. So I would encourage our families who might need that resource to please use it. That's what it's there for. So we just think that's really important. And I want to emphasize here that supporting mental health of our students is not something new. It's always been an important part of what we do. If you think about the mission of our school district, and people don't always think about the mission, but what we're talking about now, it fits so well to what we're trying to accomplish. Our mission is inspiring, empowering learners to achieve a lifetime of success. And for that to occur, we have to consider the emotional well-being of our students. Sometimes you'll hear from people, occasionally, not too often, about just teach the basics. Emotional well-being helps students have success with the basics. You cannot separate someone's emotional side from the kind of academic work that they do in school. I don't think we can do that in a workplace. I don't think that would be a very valuable place for any of our students to be in, nor would it be a very valuable place for any of our adults to be in. It's really important that we consider our emotional well-being in all that we do. So that's what we're here for. We're here to support your students. We're here to support you. If there's anything that we can do, I would encourage anyone to reach out, whether that's through the school building or through central office here, because if you have a need, I have a feeling we have someone who can help with that need. So with that, thank you. Thank you to our community members that were here tonight, and thank you to our panelists.